Narrator. Tuberculosis, commonly known as TB, is one of the world's oldest and most persistent diseases. Though it's preventable and treatable, it still affects millions of people every year. In this video, we'll explore what TB is, how it spreads, its symptoms, treatment, and how we can protect ourselves and our loved ones. Section 1. What is tuberculosis? Narrator. Tuberculosis is an infectious disease caused by a bacterium called Mycobacterium tuberculosis. It most commonly affects the lungs, but it can also impact other parts of the body like the kidneys, spine, and brain. There are two types of TB. Latent TB, where the bacteria remain in the body in an inactive state and cause no symptoms. Active TB, which makes you sick and can spread to others. Most healthy people exposed to TB don't get sick immediately. The bacteria can stay dormant for years before becoming active. Section 2. How TB spreads 2 o'clock to 3:30. Narrator. TB spreads through the air. When someone with active TB in the lungs coughs, sneezes, or even speaks, they release tiny droplets carrying the bacteria. If you spend a lot of time near that person, you can inhale those droplets. But it's important to note, TB doesn't spread through shaking hands, sharing food, or touching surfaces. Close and prolonged contact is usually needed for infection. Section 3. Symptoms of TB. Narrator. TB symptoms can vary, especially if it's not in the lungs. But the most common signs include a cough lasting more than 2 weeks, coughing up blood or mucus, chest pain, fatigue and weakness, weight loss, fever, night sweats. If TB spreads to other organs, symptoms may include back pain, blood in urine, or confusion, depending on the part affected. If you or someone you know has any of these symptoms, don't ignore them, get tested. Section 4. Diagnosis. Narrator. TB can be diagnosed through several tests. The most common are a skin test or blood test to check for TB infection, chest X-rays, sputum tests to detect the bacteria in mucus. Early diagnosis is critical. The sooner TB is caught, the easier it is to treat and control. Section 5. Treatment. Narrator. TB is curable, but treatment takes time. Most cases are treated with a combination of antibiotics for at least 6 months. Common TB drugs include isoniazid, rifampicin, ethambutol, and pyrazinamide. It's very important to complete the full course of medicine. If treatment is stopped early, the TB bacteria can become resistant, leading to a more dangerous form called drug-resistant TB. Directly observed therapy, or DOT, is a method where a health worker ensures the patient takes their medicine regularly. It's used in many countries to improve cure rates. Section 6. There are several ways to prevent TB. Early detection and treatment of active cases. Covering your mouth when coughing or sneezing. Wearing a mask in crowded or high-risk areas. Ensuring proper ventilation in homes and workplaces. Vaccination. The BCG vaccine is given in many countries to protect children against severe forms of TB. If someone in your family has TB, make sure others are tested. With proper care, TB can be controlled and eliminated. Conclusion. Narrator. Tuberculosis may seem like an old disease, but it's still a modern challenge. With awareness, early testing, and full treatment, TB is entirely manageable. Don't fear TB, understand it. If you have symptoms, see a doctor. If you're diagnosed, take your medication properly. Remember, TB is not a curse, it's a disease, and every disease has a cure. Call to action. Thank you for watching. If you found this video helpful, please like, share, and subscribe. Let's spread awareness, not infection. Stay healthy, stay informed.